Well, I'm really pleased to see so many people here. It's a very, very interesting subject. I think it's an area that's becoming increasingly important. We all know that we've got an impending obesity crisis. In fact, already 25% of children obese or overweight by the time they start primary school. The Centre for Social Justice, working with Danone, has been putting the importance of the early years on the map since really 2008. The only report that I've been involved with that I've ever seen anyone reading on the tube is the Early Intervention Pink Book that Danone sponsored us to publish. And somebody avidly reading it, and there was no doubt about it that the Centre for Social Justice with Callan MP, with obviously Ian Duncan-Smith's hugely important influence, we're putting early intervention, early years on the map, but I think the area that we still haven't quite made the necessary strides in is the area we're going to be discussing today, the importance of early years nutrition. And it's a bit of a kind of elephant in the room. I think people feel quite kind of embarrassed about suggesting to parents that they perhaps frankly could do better, could feed their children more healthily, and there's so many things involved. There's disciplining children. I mean that with a very small d. I don't mean beating them. I just mean the getting a child to eat healthily is, having two children myself, definitely easier said than done. It's not just a case of put the lentils in front of the child and they will lap them up, as we all know. But what has tended to happen over the last few years, a welcome development, the emphasis, as I say, on the early years, but it's very much educational and social development seen as the priority. And when I was looking in preparation for this fringe at a kind of policy research, I kept finding Danone's name all over it. So they sponsored or were involved with, for starters, the Demos report, and we do talk about other people's work here. And Demos basically said that social and cognitive outcomes are closely linked to children's eating behaviours, health inequalities, social mobility, huge implications for these things. So we can't ignore nutrition in the early years. They analysed the Millennium Cohort Study, regular meal times, eating breakfast, clearly significant for children's behaviour, for how they perform at school. But it's all very well to say that when children have started school and they're already in those in that stage of life. But how are we laying a good foundation so that the default for children, the default for parents, is healthy eating? So again, something that emerged from the big conversation report that Danone were involved in producing, they said that there's a real lack of confidence around a clear what is good for a school in the early years. We found, we did some research polling on this issue, and we found that while 2/3 of mothers who've weaned their babies found the information they received on feeding easy to understand, fewer than half found the information to be consistent. So every message they got was nice and clear and simple, and they got it, but the messages were kind of clashing with each other. So what do you do if you want to do the right thing? And I think that's what we felt, so many parents wanting to do the right thing. And although 90% said they had some confidence in how to give their babies a healthy diet, only around 60% of mothers were confident they could get portion sizes right. So it's a case of how much, it's not just what, it's how much. So we don't want to overcomplicate this. We don't want to say you've got to be a professional to raise a child properly, but I'm absolutely thrilled that Danone, as obviously producers of early years food, are not wanting to just flood our supermarkets, but help parents, help think tanks, help policymakers do the best job possible for children as they grow into the primary school stage of life, where school meals and things kick in. So I don't want to talk any longer. We've got a fantastic panel. I'm going to just very quickly I'll introduce the speakers as they're about to speak, so you don't forget who Izzy is by the time I get to her. And I'm really thrilled that Dr Dan Poulter, who is the Parliamentary Under-Secretary for Health, who has responsibility for maternity and many of these issues, so children's health, NHS procurement, the NHS workforce, a very, very diverse portfolio. Also, veterans' health, interesting. I'm not quite sure. Did that slip in there, or have you got? You might tell us how that fits in with the rest. But I'm really thrilled that Dan gives. He's still working as a hospital doctor, which I think is absolutely amazing. Without remuneration, I have in my notes. So, keeping close to the coalface whilst still serving the country well as a minister. So, over to you for your comments. Thank you.
Good afternoon, good evening, as it is now, everybody. It's a pleasure to be with you and to talk about an issue that I know we all think is very important, and one that perhaps hasn't, as you rightly say, had the publicity that many of the other important aspects of early years support and getting the right interventions in to support families in bringing up and giving their children the very best possible start in life. Have had, but it is an area that is important. It's about making sure that where possible we do get those foundations right for children, and making sure that we support families to give each and every child the very best possible start in life. So what I thought I would do is talk a little bit about where we've had some successes in helping to take this agenda forward. More broadly, we know there's a lot of focus now on broader aspects of the early years. Big emphasis now on perinatal mental health, more support for mums with postnatal depression and perinatal mental health issues, with specialist midwives, champions and health visitor champions in those areas. We also know that there is additional support in place to make sure each and every birthing unit has greater awareness and specialist staff trained in perinatal mental health, and that's an important part, as we know, in a previously neglected area of making sure that we support young children to have the best start in life. But today, as we talk about early years nutrition, it's also worth highlighting where some of the investment into the healthcare workforce and the increased numbers of health visitors, family nurses, and other investment, how that will bring about dividends in this area. I'm also going to talk a little bit about the importance of breaking down silos in the public sector and better joining up what the public sector does if we're going to deliver better nutrition in the early years. And I'm also going to talk a little bit about how can we raise the profile generally of early years nutrition, because we know that it's much better in everything in healthcare to move away from a reactive model of care where we're picking up the pieces when things have gone wrong, and move towards a proactive model of care where we can help people to make the right lifestyle choices and lead healthy lives, and where possible to help parents support their children to make those choices as they grow up. But the most important part very often of getting that proactive engagement, that proactive approach to healthcare is in the early years. It is perhaps one of the maternity and the early years is one of the few times when almost every child has regular contact with the statutory services, and be that through the care that's provided by midwives, the care that's provided by health visitors. It is childbirth in the early years are a fantastic opportunity to positively engage and make a huge difference to the future well-being of so many lives, and that is what we need to see capitalised upon when it comes to nutrition. So what is, if you like, where has one of the barriers been the first? First of all, there has been a capacity issue in the workforce. Many of us are aware of the vital job that health visitors do in delivering support to new families, not just in the area I talk about perinatal mental health, but also supporting families, new mums, to understand the importance of good nutrition for their children. But if we go back about 5 years, health visiting was far from the universal service it was meant to be in so many parts of the country. And if you went out to parts of Birmingham, you would find only 60% coverage, in parts of Manchester even down to 40%. So the investment that's now going into the health visiting workforce to make sure we have specially trained professionals to support new families, to support mums and families to make that best possible start in life in nutrition and in all other aspects of bringing up and bringing a new child into the world is something that is vitally important. And by the end of this Parliament, we will have 4,200 more health visitors in the workforce. That is a 50% increase in the workforce. 8,000 is the baseline, 4,200 more, about 12,000 working in the workforce, a big expansion, and that universal service, which has in the past made such a difference to young children, will again be a universal service once again. And that's one of the biggest things that I think we have done and we can do to make a difference and support each and every family to get their children that best possible start in life. It's also recognising there are always hard to reach groups and groups of parents and mums who are more difficult to reach, often have often because of their life circumstances find it more difficult to cope with the demands of being particularly a new parent or a first parent. We know that the rate of relationship breakdown is 8 times higher after the birth of the first child. It's a very joyous time of birth for a child. It's also a time when there are many challenges that parents face, and those challenges are particularly there for teenage mums and teenage parents. So we also now are putting in place, additionally supporting health visitors in what they do, and family nurses and expansion of the family nurse workforce, targeted specifically at supporting those mums we know may struggle and have struggled with some of the challenges of being a new parent. So 16,000 families will be by next year supported by family nurses, some of those vulnerable families. And a key focus of the work of family nurses is not just about supporting good bond between mum and baby, which we know is so important, not just about supporting mum back into education and training, which she otherwise may have fallen out of, but also about making sure that some of those essential life skills that are so important in cooking and supporting a new family are part and parcel of the daily routine in what are sometimes some of those most deprived families and families with the biggest challenges and biggest needs. So that investment in the health visitor workforce, in the family nurse workforce, those were things that will bring big dividends downstream. But if we want to make a real difference, it's not just about investing in the right workforce. We've got to have the right structures in the community to make a difference. The right structures actually positively engage with each and every family. And far too often in the past there have been silos, institutional silos, that have been between the NHS, who have done things in one way, local authorities, which have so much to do with social services care for young children, not as much for discussion today, but educational provision as well. And there has been a siloed approach to the delivery of public services, when actually what we're looking at is the same child with the same needs, that has the same need to succeed and have a good start, a positive start in life. So 2 things that will make a difference, I believe, going forward in breaking down some of those silos. First of all, from a healthcare perspective, there are now health and wellbeing boards in each and every local authority area. Almost, I believe certainly well over 50% of those have the best possible start in life, this agenda, the early years agenda, as a key priority for the delivery of those boards. And health and wellbeing boards have on them representatives from not just healthcare, not just social care, housing, other providers of care, and bringing the voluntary sector in as well, and a look to have a much more coordinated approach across the public sector to the delivery of key priorities. Some of those priorities will be for older people, but there's been a big driver for health and wellbeing boards has been getting it right upstream, getting it right first time, getting it right in the early years, and that's something that I believe as we go forward, how we actually better integrate and join up the public health offer, and those health and wellbeing boards have already proven to be an effective fulcrum for having proper discussions about how to do exactly that. And the other thing that I wanted to touch upon very briefly in the issue of breaking down silos is also the need to make sure that some of the models of service delivery and reaching out to new families outside of the NHS haven't always linked together with the NHS. So once the offer from the health visitor is over, once the health visitor or the midwife is no longer in contact with the family then hasn't necessarily had ongoing support beyond that immediate period after childbirth. Increasing the number of health visitors, of course, will mean that health visitors can fulfil their traditional role more effectively. But it's equally important if we're looking at the first 1,000 days, which is so important after childbirth, and we know it makes such a big difference to a child's life chances and future health, that there is much more joining up of what the NHS does with what the offer may be at children's centres and other opportunities for community engagement. And that is where health and wellbeing boards will be effective in helping to outline what that offer will be, which will be different here in Birmingham from where it would be in rural Suffolk and parts of rural Suffolk that I represent. But that is the challenge, breaking down those silos, joining up what the NHS and other parts of the public sector do to make sure that care and there's more seamless care for families, and that will help to put this agenda much more at the forefront of everything that happens. Finally, I want to say that I hope that those reassurances that we now do have the right workforce, we have the increasing numbers of the right workforce, and we have a structure in place to break down those silos will make a difference in joining up care for young families. Finally, I think it's worth pointing out that we need to make sure that nutrition is not the poorer relation to all the other aspects of early years care. And there is a key role in that, and a key role in doing that, I believe, particularly of better partnership working, not just in the statutory services, but also working with organisations like Danone and also with the voluntary sector to make sure that this agenda can be pushed further forward. And if we know that if we can get it right in the early years for a child, if we get a child set off on the right path with the right the right healthy approach to food, fitness and exercise with good nutrition from early years, that child will do better at school, but equally as importantly, from a future health and lifestyle perspective, he's much more likely to be a healthy adult and not an obese adult, which is better from healthcare economic terms as well. So upstream intervention, a focus on proactive intervention, proactive care is absolutely the way forward in this area. It does take some financial pump priming for those local authorities in that joined up working with the NHS. But that pump priming pays itself back many times over with healthy, fit adults who will lead much more fulfilling lives and will do much better and help you have a much better opportunity to get on in life. And equally as importantly as the economic case is the case that we'll have a much fitter young generation. This is not an overnight success story, this is a long-term project, one that will make a big difference. The right workforce, coordinated approach across the public sector, I know this is something we can deliver, and I know with the people's commitment in this room, we're definitely on the right track. And I'm very happy and look forward to taking questions a little bit later on. Thank you.
Great. Thank you very much. Strands to pull on. I hope we will do so in questions. I think one reason why early years nutrition is not seen as a poor relation is because of the work of our next speaker. I've known Helen for several years, and I would say she is such a good advocate for her cause. Not only is she very much a healthcare professional in her history, she's not always been a corporate animal, have you, Helen?
I'm not an animal now.
Originally trained as a nurse, worked as a cardiothoracic staff nurse, a senior nurse, and then retrained as a family planning nurse, moving into more of a community role, perhaps around the time when you had your own children, I don't know.
Yeah.
Okay. But I think the respect for research that I have noticed in Helen's work, in Danone's work, you've sponsored the Infant and Toddler Forum that is an independent expert group providing peer-reviewed evidence that's practical and leads to really good information to healthcare professionals, carers and parents, this kind of integrated approach that Dan has talked about. So I'm over to you, Helen.
Okay, thank you. Well, you've just about said everything I was going to say now, but never mind. Well, you know, it's great to be part of a panel that's got such a broad spectrum of expertise, both academic, policy and on the ground, so I'm really looking forward to hearing from Izzy. And thank you everyone for coming, I know it's a busy time of day. The CSJ report, Breakthrough Britain 2015, which I'm sure most of us are aware of, focused on child protection and mental health issues and health services for children and young people, and painted a very moving and detailed insight into the lives of very vulnerable children. And although in many ways feels a far cry from what we're talking about today, I think there are some real noteworthy policy parallels. The need for better integrated services, the absence of comprehensive and up-to-date data, and the all-important role of early intervention. And I wanted to take the opportunity today to take a few days about why Danone and Nutricia are here today and why we're sponsoring this event. as Dan said, it's a fact that what children do eat and experience during that first 1,000 days of life, that is pregnancy to preschool, may have lifelong consequences for their social, emotional and physical development. And even though the science tells us that early life nutrition can be critical to long-term health, it often seems to fall between the cracks of government departments, policies, and can potentially leave the next generation in Britain at risk. I mean, it's been said already, we're well aware of the overconsumption of food and calories, leading to childhood obesity and onward into adult obesity and associated problems. But we also have significant numbers of very young children at risk from micronutrient deficiencies such as iron, which may be linked to poor intellectual development. So recently, there have been some really good nutrition initiatives driven by the coalition governments, such as the traffic light GDA labelling and free school meals for all infants. And these go a long way to improve families' understanding and awareness of a good diet, and especially for those children from disadvantaged families, and we do welcome them wholeheartedly. We also welcome the decision to extend into pregnancy and merge Start for Life with NHS Choices, which gives parents a one-stop shop, if you like, one source of information. Although our view of this is this still doesn't go far enough. So based on the insights I'll share with you from the information that Samantha's alluded to, some of these initiatives still doesn't really enable families to really understand and cater for the very specific needs of the very young child, the preschool child. And the overwhelming evidence is that children's nutritional preferences, behaviours and habits are set in infancy with lifelong implications for social, physical and emotional well-being. And indeed, for some children, by the time they reach primary school, so that's 4 years old, it's too late. And we've already heard the statistic of 25% of children arriving into reception overweight or obese. And that's a statistic we just hear too much of, really. We believe that early life nutrition is a critical problem that needs to be addressed. So I'd like to remind some of you of the Demos 4 Starters report. It was a report, as Samantha said, that I was part of the steering group. I represented the industry body, and I can assure you it was a very long, very deep and very robust review of the data. And Demos concluded then that policymakers had been less engaged with children's nutritional needs in the early years, focusing instead on their educational and social development. And 2 years later, nutrition still doesn't occupy a central role in the early intervention policy agenda, despite the fact there have been a number of rollout policies that it could have been. So by overlooking nutrition in early life, are we overlooking the most important stage of all? And with an election around the corner, that's the question we'd really like to raise. We believe the time is right to reappraise the debate and bring it back to real life and reflect on families' experiences and challenges. The time has come for all stakeholders to work together to find a solution, whether it be on a policy framework or some other initiative that can really help those responsible for feeding children receive the information and the support they require. By working together, we can give Britain's children a better start, as has already been alluded to, and that's industry working with think tanks, policymakers, retailers, and all other associated stakeholders on an issue that spans a number of government departments and in a way that really champions early life nutrition and delivers change. So what about Danone Nutrition? What have we been doing? As a nutrition company, as has been said, we take our responsibilities very seriously, not just in the food that we make and the information that we give, but for the last 10 years we've supported through an educational grant the Infant and Toddler Forum, a group of nutritional experts delivering practical, evidence-based advice. And an example of this is the 10 Steps for Healthy Toddlers, which is a set of tips to help parents and carers make good food choices and manage toddler behaviour, feeding patterns. And these steps are being disseminated through childcare settings through a number of partners, and they currently reach about 2 million children and their families. But more recently than that, we held a big conversation, we called it, which was in Birmingham, and again Samantha's alluded to it, and it was a deliberative event which brought together 60 parents, carers and healthcare professionals to share their experiences face to face, to provide an opportunity to really refresh our own understanding of why families and carers often struggle to achieve good early life nutrition in practice. So we captured the views and knowledge, first-hand experience, and actually 4 key themes emerged. I'll top line them for you. So parents often feel pushed into making affordable food choices, often steering away from what are perceived more expensive, healthier options, turning to convenience food for the whole family. So cost was one big area, and that touched almost everyone regardless of their background. Information was another big theme. Information overload from many sources, often contradictory, can leave parents confused and uncertain, and they often feel paralysed to act, and they do talk about muddling through. And as parents juggle work and time with their children, time becomes another key issue, leaving eating patterns unstructured and often families eating more frequently and less healthily. And that leads us on to a changing lifestyle, really. Lifestyles are changing so fast for all members of the family. Both parents are very likely to be working. The responsibility for feeding a young child is often shared between several adults and different childcare settings, both formal and informal, and therefore consistency and disruption is left for the children around food and feeding. So lifestyle, time, cost and information were the top line themes and conclusions from the event, and we have copies which look like this for you to take away. And what we really want, the report was not designed to be a policy prescription. It was designed to be a catalyst to start the discussion, to start the conversation, and really discuss what lies beneath some of these barriers. So what we want is your commitment and your commitment for us to work together to debate how we can champion and progress the important issue of improving early life nutrition. I repeat, let's work at creating some solutions and actions to deliver consistency across government, and deliver real change for pregnant women and young children and the people who care for, shop for and feed them. And we look forward to working with you. Thanks.
Thank you very much. Well, our final panellist, I'm really delighted we've got Izzy Neale from 2020. 2020 is a member of the CSJ Alliance, so it's not just a member, it's an award-winning member of the CSJ Alliance. And they work with the most vulnerable young people in Loughborough, where I come from. And when I said that we had a stellar panel, I wasn't exaggerating, because Izzy was actually named Star of Loughborough just 2 years ago for all of her voluntary sector in the town. So Izzy, you've got an awful lot to live up to, but I know you will come through very well. So
thank you. I am actually going to stand up because I'm used to standing up. So thank you. So 2020 works with the most disadvantaged young people across Leicestershire. We are passionate about seeing young people both engage in education but also thrive emotionally. These are young people who have been excluded from school, who are the long-term unemployed and who live in some of the top 10 most deprived estates in the country, and who ultimately feel excluded from society. Our aim was to meet them in the middle of this, to get them back into work, for them to develop self-belief and motivation, but ultimately for them to have belief in themselves and their future. We believe in positive people, positive places and positive opportunities. I manage one of our projects called Love for Life, where I've worked with every year I work with hundreds of girls on some of the most deprived estates. Girls that live in overcrowded houses, that are caring for their younger siblings, or who are being sexually exploited by older men, and who have such poor emotional well-being, their only release is to self-harm. We truly believe our young people are fantastic, but they just need someone to believe in them, and they need a chance. So when I was asked to talk about this particular issue, I kind of came up with four thoughts, but I wanted to highlight these with stories as well, because I think the stories really make them. So thought one, we know a lack of nutrition understanding is costing the families we work with. We are increasingly seeing social services observe the young parents we support on whether they provide not only the right environment, but also the right nutrients for their child. And with policies being put into place, we can see that we have a government that really cares about positive changes, which is fantastic. I know that for me to make these changes, I can easily go to the local shop and buy healthy food, or go to the gym on a weekly basis. But imagine if healthy eating for a young person is actually just eating, because for them that's their reality. I recently worked with a young mum, who thought feeding her child a Subway every day was a balanced diet, It contains some form of meat and some vegetables, and if everyone was eating it, then surely that's okay. But the result of that, her child being taken to social care, her parenting being scrutinised, and the child's future being left in the balance. Yes, have policies, but let's remember it's not as easy as putting a healthy plan into action, because for these young parents, they just don't know where to start. They are playing catch up and are penalised because they can't even comprehend what they need to do. The answer? Education. This is so critical. At 2020, we go back to the basics, getting them to understand the importance of looking after their own bodies first, where they can then see the impact of how they feel and then transfer these skills onto their child. The impact? Not paying the price of losing their child because they just don't have the understanding. Thought 2, healthy eating versus budgeting. Countless times we see teenage mums stuck in the cycle of eating ready-made meals, deeming it good budgeting and therefore a great parenting decision. Why spend £3 when you've got a 99p meal ready to go? Which is fair enough. Looking after their money is critical, but eating healthy is important too. Yet for the young parents we support, these are just both out of their control. Every day they are faced with the choice of paying their bills or buying food, so for them, food is the first thing that goes. They may be able to look after their money, but it doesn't mean they have the money to spend on food. I think we need to really wise about what we're pushing and how we're pushing it. For these young people, they already feel like they're making a good choice by buying fast food because it's cheap. Yet generally more expensive food is seen as healthy, which is kind of what we've spoken about today. We have 3 young parents with us at the moment, 3 single mums who have just come through our programme, and they've got an apprenticeship, which is fantastic. And generally they're handling their money really well. But on £2.68 an hour, cheap food makes more sense. For them, buying fresh food just places them in a more critical situation, and why would they do that? For these girls, we brought them again back into the kitchen. We got them used to being around fresh food. We showed them cheap yet tasty alternatives and had them support our other education projects to make food for them, so they could see just how far their money could go. Thought 3, practical skills equals confidence. Imagine a young girl forced to live on the streets where she was addicted to drugs and being exploited by older men. Heart-wrenching? Completely. Not something you imagine for a 16-year-old girl. The great news is she survived such a horrendous past. But now, aged 17 and living on her own and discovering she was pregnant and having to live in her own home and fend for herself, she was faced with just such a horrible situation. This was a girl who thought eating energy drinks and drinking ready drinks, energy drinks, and eating ready-made meals was a balanced diet. Because again, it was actually food, so for her she was eating something. She had never had someone talk to her about healthy living due to such a disruptive home life. We instantly saw this pattern of eating and wanted to help her break this cycle, but without the skills or the confidence, she had no idea how to do this. So again, we went back to the basics, doing taste tests. We took her to our local supermarkets where she was able to handle fresh products. We also spent time cooking with her in the home, so she felt in control of her own environment and where she could continue with these lessons she was learning. Thought 4, eating together means learning together. In a world where everything is fast-paced, it's not surprising this is transferred to food. A quick meal means no fuss, yet no time to communicate. We are big believers in eating together, yet over time we have seen this completely evaporate from today's society. Eating together can help form that family bond and bring family togetherness, yet for the mums we work with, this isn't always possible. One of our single mums wanted to have a career path. So for the past 6 months she's been doing just that. She wanted to provide the best for her child, though having to drop her child off at nursery at 6 a.m. every morning and not picking him up until 6:30 p.m. She was missing every meal with him. Sometimes health, specifically emotional health and resilience, goes far beyond nutrients. I'm sure there are many parents here today that say they have sacrificed their own physical and emotional needs for their child, but how far do we let this go? In conclusion, These are just a few of the issues affecting young parents, but there are so many more. I love that early child nutrition is being looked at, but let's remember it's really easy for the middle class to put these into action, but the young people I support, the disadvantaged, they're the ones who have no idea about policies, have no idea that they're doing anything wrong, and are left behind in an already fast-paced world. This is why projects like ours are so important.
Great, thank you so much.